Well, here to discuss the medical aspects of the crisis is Dr. David Agus. He joins us now from Los Angeles. Dr. Agus, good morning.
Good morning to you.
Oh, New York is currently the epicenter for the cases in the U.S., and this week we saw the highest single-day deaths. But data also showed a slowdown in cases. What phase are we at in flattening this curve?
Well, we hope and pray that the data reflect a trend, and they're going to continue. But they're showing is fewer hospitalizations, fewer ICU intensive care unit admissions, and fewer people going on a ventilator on a daily basis. And so they were going up. Now they've flattened. The deaths had not yet flattened, but there's a delay of about a week between hospital admissions and decrease in deaths. We hope that's going to continue, and it's not a slowing of the curve, but it really is a flattening of the curve.
The virus isn't going to magically disappear. If the rate of the new cases continues to decline, how do we determine when the right time is to ease those stay-at-home orders?
Well, I mean, there are two components, right? There's getting the disease incidence very low, and then there's us getting ready as a society, as a country. We need testing. That is, who has the virus, to be in the millions per week. We are not there yet. We need the ability of testing who has been exposed and actually has immunity, so it doesn't have to worry about catching it again or spreading the virus. That test has not yet launched. And then we need the ability to social trace. That is, there will be people who test positive, and when you do, we want to go back and see who you interacted with the days prior, because all of you need to be back putting your homes, and we will wait a period till you can go back out again, and then we're going to stop that virus. But there needs to be that three-pronged plan, which isn't ready yet. So slowing the cases together with technology and our plan together, then we're going to be able to let the dogs out, if you will, and all of us go out. But it will be graded, right? We'll go out with masks at first. Higher risk people will stay in. It's not going to happen all at once.
Dr. Agus, what about treatment? We've heard about, obviously, the search for a vaccine, but also how to treat the virus. Where are we within those two things, in terms of those two things?
Well, there were two big things that happened this week. One is the New England Journal of Medicine published a study on remdesivir. This was the drug, intravenous drug, that was developed for Ebola, that had activity against this virus in multiple laboratory studies. And the first human study showed that in about 56 people, about 2/3 actually got better. These were people on a ventilator. And so it didn't have a control arm. That is, we don't know who would have gotten better on their own, but the drug was well tolerated, and it appeared to have some activity in this study. The second is, this is a virus where, it's not a live organism. It actually goes into our cells and uses our own machinery to divide. And there is a drug called a protease inhibitor that can actually block its proteins from interacting with ours. And it was developed specifically for this virus. Pfizer has made it, and the initial laboratory data look encouraging. So those two, to me, are exciting and steps forward. We're certainly nowhere near where we need to be with the drugs, but we are taking baby steps forward. And my hope and prayers are one of those drugs will work, because that'll dramatically change our stress level if we can treat this disease.
It sure would. All right, Dr. David Agus, thank you.